Improving the Management of Type 1 Diabetes in School-Aged Children in the Cheltenham School District by Tasia Walker. The Cheltenham School District is located in the northwest suburbs of Philadelphia and serves a population of 37,000 residents. The school district is a highly diverse population with a student body population consisting of 53% African American students, 35% Caucasian, 7% Asian, 4% Hispanic, and 1% containing all other races. There are 4 elementary schools, 1 early middle school, and 1 later middle school, and 1 high school. It serves approximately 4,700 children. In the past school year, for the 2016-2017 year, there were 13 students that were cared for who have insulin-dependent diabetes mellitus, also known as type 1 diabetes. This project is focusing on the population of students with type 1 diabetes. So what is type 1 diabetes? It is an endocrine disorder that affects the pancreas in children and stops insulin production. Insulin is a hormone that is secreted by the pancreas to balance blood glucose levels and transport glucose into cells for energy. It is treated by continuous monitoring of glucose trends, especially during meal times, calculation of carbohydrates and insulin ratios during meals and snacks. Insulin can be given externally through an injection or an insulin pump. A low-carb diet is recommended when students are diagnosed with type 1 diabetes. This slide represents 2 ways that insulin can be administered to the student with type 1 diabetes. The right image shows insulin in a vial that must be drawn up and given subcutaneously during mealtimes. The left top image shows an insulin pump, which is connected to the student through the abdominal wall. It is, as you can see, the image shows that it is as deep as the fat layer because it's a subcutaneous injection. And the student during mealtimes must calculate their carbohydrate count and their value for their blood sugar at that time and determine what amount of insulin they need to cover them for that particular dose. Insulin is a high alert medication and can have serious adverse reaction in the event of medication error, which can include death. So it is extremely important that these calculations be double checked and be accurate so that the student is not put in any harm. Our current school policy and procedure for caring for the student with type 1 diabetes includes implementing and managing a care plan received by the physician, monitoring, calculating, and recording carbohydrate count and insulin administration during meal and snack times, agency-only nurses to accompany students on field trips, observing and treating for signs and symptoms of hypoglycemia and hyperglycemia. Some issues that have occurred with our current policy include school trips and extracurricular activities have a low attendance rate with students with type 1 diabetes. Parents have expressed that they did not know that nursing services are available for off-campus and after-hour activities. Parents have also expressed that they do not feel comfortable with trusting their children with an agency nurse due to unfamiliarity with personnel. This is due to a lack of collaboration and communication with parents, faculty, coaches, and counselors. Other issues with current policy for the student with type 1 diabetes include blood glucose levels being outside of target range. This can be due to noncompliance with dietary intake recommendations, unaddressed behavior and emotional needs, and knowledge deficit of the disease process. This can be contributed to our lack of long-term assessment and evaluation protocol. Currently, we have an infrequent parent communication, no organizational tools to assess students, and we are not addressing the underlying issues of the type 1 diabetes student. The proposed intervention is a hybrid approach. It encompasses case management, collaboration strategies, a long-term assessment plan, increased involvement of parents and faculty, and policy reform. The proposed intervention specifics are advocating for policy reform that allows school nurses the option of attending off-campus trips, parent and nurse interviews for new students and checkups for existing students at the beginning of the school year, care plan review and setting goals for the upcoming school year during this meeting, information dissemination of nursing services available for trips and activities through verbal education with a supported take-home handout. New documentation tool that establishes a baseline assessment of special needs for the student. Assessment tool will be used throughout the school year with means to document illness-based absences and classroom trip attendance. A mandatory collaboration and safety plan development with individuals that are accompanying students on trips and after-hour activities. This includes teachers, coaches, aides, counselors, anyone that would be responsible for the student. Also, a midway assessment to determine if goals are being met or if plan revision or education is necessary to finish out the school year. The supporting evidence includes a position statement by the National Association of School Nurses saying that they support a central role of the school nurse in providing case management services for children. In qualitative data, one study shows that better communication and planning with other staff has a better impact and perception to parents when students participate in school activities. For our quantitative data, a study has been known to yield positive results for implementing case management for students with type 1 diabetes. The results showed an increase in academia, attendance, self-care, and participation in extracurricular activities. The proposed intervention is a combination of these two strategies, and it suggests that collaborating with teachers, meeting with parents, reviewing policies, and case management are all interventions that have yielded positive results when it comes to student success in health and academia, as well as involvement in school activities. When applying the nursing process to this clinical issue, we find our problem is split into subjective and objective data. The subjective data is parents stating that they are not aware of resources to school and the policy that a nurse is required to accompany children on field trips and competitive sports. The objective data consists of students with type 1 diabetes collectively having missed a total of 9 trips in the past school year due to parents not knowing about the availability of nursing services. 3 students currently in district are not managed well as evidenced by consistent blood glucose values above target levels. 2 nursing diagnoses for these include ineffective communication related to lack of nursing coordination as evidenced by parent keeping student home because of no confirmation of trip nurse assignment. The second diagnosis is a knowledge deficit related to a lack of parent communication, as evidenced by student being restrained from playing sports in lieu of student safety. Some outcomes we are hoping to achieve include students having a more consistent blood glucose level within desired range, students participating in field trips and activities throughout the school year more frequently, parents reporting increased satisfaction about the coordination of care, and students demonstrating proper technique for blood sugar testing, carbohydrate calculation, and insulin administration. Some interventions include advocating for leniency in school policy for the school nurse to attend school trips per the parent's request, the parent-nurse meeting to start in the beginning of the year to evaluate the student's routine, care plan, doctor's orders, and any special permissions and/or restrictions. This will also be an information session to notify parents of health resources available to students to participate in extracurricular activities. For students not meeting target blood glucose values on a consistent basis, a session to address and develop a care plan to improve blood glucose values and dietary intake. A baseline focused assessment of a student's medical status, quality of life, and any impeding factors. And finally, communication with teachers, counselors, physical education teachers, and coaches about goals and plans for the student. The evaluation process will take 1 school year's worth of data collection after the intervention has been implemented. Subjective data after education will be evaluated through verbal confirmation of health goals and measures needed to achieve optimal results. Semi-annual meetings with parents to discuss the effectiveness of plan of care. Parents will express foods and behaviors at home to control hyperglycemia. Parents will acknowledge that their child has the right to participate in school-related activities per the Non-Discriminatory Act and that medical services must be provided by the school district when applicable. Knowledge of students' conditions and needs during extracurricular activities evidenced by staff verbal summary. The objective data will be evaluated through ongoing measurement and evaluation of daily blood glucose checks, improved school nurse attendance on school trip days, and students' reports of missing school trips and activities related to disease management will be decreased in occurrence. All in all, it will take 1 school year in order to be able to assess the Some closing thoughts and things to consider is that the goal of school nursing case management is to address and manage the needs of a student so that they are ready to learn and have the best quality of life. School nursing is becoming more complex and demanding, so policies must be revised to meet best practice. Caring for the student and not just the disease is the staple of them living a long, healthy life with good habits and hoping that they carry these good habits into adulthood. But it all starts at the school level because we are the most influential people in their lives because we spend so many hours with them. So thank you for listening to my presentation.